This is another episode of the Blossom Podcast, your number one source for everything bariatric surgery, from pre-op to post-op. Registered dietitian Alex Conception gives you real, raw tips and motivation through your journey. This is the Blossom Podcast.
What's going on, guys? Welcome back to the Blossom Podcast. I am here with the better voice of the Blossom Podcast, Catherine Kyle. Say what's up.
Hello, everybody.
And we are doing part 2 with your surgeon, Dr. Rogers Andrew. He likes to...
It's like, I know, I want to call him Dr. Rogers, or just sometimes Rogers, because I call him Lapel, or Umbach, and it's like, wait... He wants to be called Andrew.
He wants to be called Andrew. So we are here with your Dr. Andrew.
There it is.
There it is. For your frequently asked questions. The questions that say, hey, what does the doc have to say about this? I want to talk to the doctor and I want him to answer these questions.
We got a ton of these, Alex, too. I tried to whittle them down to some of the good ones, or some we asked our group, but I also look at other Facebook groups or just topics or forums in general of, if you could sit down with a surgeon for 20 minutes,
yes,
what would you ask them? So I think we'll get into some good ones.
So we have a surgeon that we can sit down with for 20 minutes. Andrew, what's going on? How are you?
I'm good, guys. How are you guys doing today?
Fantastic. Awesome. It is a beautiful day, and it just got better hanging out with you, brother.
Always a good time, man.
I love it.
So let's fire away. What's the first hot topic?
Okay, so I'm going to ask this question, but I'm going to preface it with this. If you don't know how the surgery's done, watch a video about it, because there's a lot of people that just ask questions like, how do they even get the stomach out of there? Or, these questions that you could be answered by simply watching a YouTube video. So we're not going to go there, but I do want to ask you, one of the hottest questions is, how much of the stomach is removed during a safe sleeve surgery? No, specifically with the gastric sleeve. We're not going to discuss any other procedures at this time, but how much of the stomach is removed, and is it different for everybody?
Sure. That's a great question. So with regard to your first question of how do we get the stomach out, the answer is very carefully.
That's it.
But the question of as to how much of the stomach is removed. So the short answer is it is a little different for everybody. It's not so much the size of the stomach you start with as much as it is the size of the stomach you end with that we kind of that ends up being sort of the standard. And the way we do it is we basically pass, for lack of better terms, a medical garden hose through your mouth.
That's the bougie, right?
Yes, the bougie, correct. Yes, bougie, which I'm not sure how you actually spell it, but B-O-U-G-I-E is how I usually do it. Pass that through your mouth, and it goes and it sits in your stomach, basically. And what we do is we use that to sort of say, well, this is how big we want the stomach to be when it's done. And so once we know how big we want the stomach to be, we then take our staplers that we use to help divide the stomach, and we kind of just cinch them right up next to that bougie, and we staple off. And once we're done with the safe sleeve, we've got that piece of stomach that's been detached, and that's the piece that we take out. So depending on how big your stomach was to begin with, that can be sometimes over 90% of your stomach. Generally speaking, it's somewhere in like the 60 to 75 or 80% of your stomach that is removed. But I think the more accurate measurement is what you're left over with, and that's about a stomach that will hold probably about 4 to 6 ounces of liquid. And that variation is based on more than anything how tall you are, right? And so the taller you are, the more it'll hold a little bit because your stomach's just a little bit longer. So, if you're 5 feet tall, it might be somewhere around the 4 ounces. But if you're like 6.5 feet tall, you're looking at probably 6 or maybe even 7 ounces. But generally, it's in that 4 to 6 ounce range that you end up with at the end of it.
Interesting.
That is extremely interesting. So beforehand, how much you remove? Do you experience a large array of sizes before surgery?
Of original stomach?
Very large array. And it's actually somewhat surprising sometimes as to sort of, what you might expect going in, because there will be times that you think, oh, this patient is, a higher BMI or has, has a weight that's a little bit on the higher side, and they may have not as big a stomach as you think of, or vice versa. And so generally speaking, I actually find that the folks who have the bigger stomachs are the ones who may feel like they get a lot of benefit out of this, because they simply don't, by reducing that stomach size so dramatically, they just don't have the capacity to be able to put in sort of the extra things, the things that have been tripping them up as much. And so it's often hard to predict, but we're always excited when it sort of all comes out about the same size.
That's cool. Now back to this bougie, aka the garden hose, medical garden hose.
Garden hose.
Now I'm picturing, like, when you say garden hose, I'm thinking like an inch in diameter. And are there different bougie sizes? And what do we use?
Sizes. We use what's called a 36 French bougie. So it's not actually measured in inches, and if I'm not mistaken, a French is about a third of a centimeter, but I'd have to look that up again to double check. But if you're curious, it's about the width of your thumb if you look down. You know, I think I have probably about average size hands, and it's about the width of your thumb that bougie ends up being. So 36 French if you want to look that up.
Not bad, not bad.
So my next question is, can I request my stomach size? And that's a real thing. People are like, well, I think my doctor only took 70% out and I wanted 85 or 90%. And this is a real thing that people say, you know, I don't think he took enough out.
Well, yeah, many times as you didn't take out enough stomach. So can you choose a size or request a different size?
So unfortunately, we really don't actually do sort of stomach on demand, as it were.
A custom size stomach.
Yeah, it's something that
tailor-made.
I don't know if you guys have ever requested somebody actually have it be a little bigger or not. My guess is that probably the majority.
I've heard that too.
Yeah. But my guess is probably the majority is, hey, make it as small as you possibly can, and that's what we do with the bougie. Actually, we try to keep it sort of as small as you can. If you get too much tighter than that, then the normal passage of liquids and once you get to it, sort of soft solids and advancing your diets, it's actually too narrow to allow that to happen. And so we don't want to create a situation where you're not able to put anything in. You know, that's not compatible with life. So we like to create a situation where we're able to limit it, but limit it in a way that is still safe for you. So if we go smaller than that, we generally find that it's not safe for people to actually go, you know, and try to continue to get the calories and everything they need at that. So.
Absolutely.
Awesome. So when it comes to going back to you saying we're essentially resetting, right? Everybody is going back to roughly around the same size. Why would somebody have more restriction versus somebody else, or the idea or feeling of more restriction than somebody else?
So in other words, why do they feel fuller quicker? Or
I've example, I can only tolerate X amount of food when somebody else who had their surgery the same day is tolerating more or less, those type of scenarios.
Sure. Yeah, absolutely. So if we're talking in the immediate post, like right afterwards, part of it is, I think, twofold. Right after, everybody responds to anesthesia a little bit differently, and responds to the operation a little bit differently. So your stomach may be a little bit, you know, for lack of a better term, upset that we just cut it in half, and so it's not going to be really amenable to some people's stomachs are a little more settled, and some people are a little bit more upset, and the nausea and sort of the stomach irritation can be something that prevents them from really being able to get everything in that they feel like they should. Sure. The other thing to keep in mind, which we kind of touched on a little bit, is that, you know, even though the sort of diameter of the stomach is the same for everybody, the overall capacity differs based on height a little bit, and also based a little bit on sort of, you know, things like age and stomach stretching and stuff like that. Now, you know, when you feel your stomach start to stretch, when you feel that, obviously that's a signal to sort of slow down and kind of listen to what your stomach's telling you. But some people are able to stretch a little bit more than others, especially younger folks who have the operation. And so that may be a reason they seem to tolerate it a little bit better and don't feel nearly as much, I think you said, resistance out.
Yeah. So would it be, you can even contribute that to just your own personal pain tolerance as well?
Could be. Absolutely. And everybody, like I said, it kind of tolerates the operation a little bit differently. Now, down the line, of course, you're talking about things like, you know, how well does your stomach sort of send the signal to your brain saying, hey, I'm full, right? And so some people's brains get that loud and clear, and some people's brains just aren't as good at paying attention to that. And that's no fault of anybody's at their own, but they're able to sort of get a little bit more in there before their brain is like, oh, hey, hold on a second. So it varies a little bit person to person, but it has more to do with things that aren't necessarily in an individual's control, and have more to do with just sort of the way your brain and your stomach interact.
I see both both people saying, I feel so full after one bite, and then I see, again, these are the type of folks that had surgery same day, same week, and then another person saying, I just can't eat enough, I feel like a bottomless pit. And I know Alex is always talking about that head hunger and recognizing what that is compared to real hunger. And tell me a little bit about the ghrelin hormone and where that falls in place with the stomach removal or the sleeve surgery.
Sure, absolutely. So for those who haven't had a chance to sort of, dig into what exactly ghrelin is, what Catherine's talking about is a hormone that is mostly made in what's called the fundus of the stomach. It's kind of the big bulbous part that hangs off the kind of the top right corner as you look at it on a flat picture. And that's actually most of what we cut out is called the fundus. And so ghrelin is a hormone that travels from the fundus and goes to the sort of mid-brain area, sort of, for lack of a better term, not like the thinking part of your brain, but sort of the subcortical, or the part of your brain that isn't necessarily like always active in terms of like you being aware of what it's doing. And when it gets there, it basically convinces you that you're starving to death. So I always tell folks it's kind of like it goes to the stupid part of your brain and says like, oh my God, I'm starving. Why aren't you feeding me? Right. And the smart part of your brain knows how to do things like count calories and, keep carbs on the lower side of things and stuff like that. But that stupid part can be really loud sometimes. And so it's hard to ignore. I have 3 kids under the age of 5. And so I kind of liken it to when my kids are sitting there like tugging on my sleeve over and over again, trying to get me to like pay attention or give them something, whatever the case may be. So eventually you just kind of, you give the kids something to get them to kind of stop, to, be quiet. And so if ghrelin is acting that actively sort of in that lower part of your brain, it may be sort of saying like, you may just eat something, even though you're like, I don't actually want to eat anything, but I can't focus. I can't stop because my stomach is just driving me crazy. And so the idea behind one of the ideas behind the sleeve gastrectomy is that it should reduce those hunger cravings, because it should really reduce your levels of ghrelin. And so instead of having to just feed your stomach to get it to shut up, we should turn the volume down on that and give you more control over what you've been trying to accomplish.
Long term, does the ghrelin stay gone?
It's a great question. So to my knowledge, it never goes away wholly, but it should buy you enough time to be able to get you a little bit more of a control over your relationship with food. In other words, being able to sort of say, hey, my stomach has shrunk a little bit. I've got like, I don't have to ignore myself as much anymore. Like those cravings that, like I said, the volume gets turned down a little bit. So can ghrelin still be in the system? Absolutely. And it can be a good thing, right? There's times when, realizing that you're hungry is a good thing. But for a lot of folks who have carried a little bit of extra weight, whose stomachs have been stretched out a little bit, it can be a little bit of a maladaptive response. And so by kind of reducing the amount, by giving you more control over it, the hope is that you're able to reset back to a level that you're able to actually control things and feel like you're more confident in doing what you want to do.
100%. And I'd like to add to that too is that relationship with food. Although the hormone is gone, it doesn't change your relationship, and it cannot take away your experiences with food in the past. Right. So just as Andrew was talking about his kids, tugging on his leg or his jacket, and you're rewarded, that's the same thing. That's learned. That's not hormonal. You're gonna turn on the TV at night, but before you do, you always maybe open the refrigerator, grab a pop, or a soda, or those type of routines. And I like to say on Sunday, it's fun day. You normally go out to eat with the family, or it's game day. And what goes along with game day is pizza, beer, and wings, right? The game will still be on. Yes. So that's the scenario and the reward essentially, or the routine that you're telling yourself, hey, the game's on. I have it. This is associated with something that's not hormonal. Wow. So this is something that just to be aware of when it comes to that head hunger. I like to talk about as well. So yeah, just a little to add on to that.
Yeah. So you're retraining. You have the procedure just because you have 80% less of your stomach doesn't change a whole lifetime of experiences or habits or all of that stuff.
Yeah, and like I said, the hope is that it kind of turns the volume down so that it's easier for you to break those habits. But it is something that you definitely, I think, want to pay attention to sort of maximize your success, because you realize sort of as you remove some of the pressure from the situation, you're kind of like, like Alex said, like, what am I doing at the refrigerator? I just had dinner. Like, I don't need like
you're
a
bored
soda
or
to
you're
watch
bored,
TV.
What do I do now?
Oh God, has anybody ever been bored during a pandemic or something like that? You're literally sitting at home going like, I guess I should eat again. Like, what else am I gonna do? I've done my work for the day. Like, it's brutal sometimes, but yeah, that's absolutely true. You just gotta sort of realize, hopefully, minus a little bit of that stimulus, like you can realize how much you're like everybody, not just you as a patient who's working after the sleep, but everybody is a slave of habit, and so you kind of want to say to yourself, why am I doing what I'm doing, and sort of, is this something that I need to do?
Same thing like with your phone. How many times have you checked your phone, you think it rings or you think it's buzzing?
Mm-hmm.
There was no buzz.
There was no buzz, and then you're just mindlessly
Yeah,
scrolling your
exactly.
feed. Like, there's nothing to even
I'm
look
pretty
at
sure
here.
my leg phantom vibrates a lot of the time.
All the time. Me too.
So back to more like, again, the technical aspect of the surgery. We talked a little bit about how much the stomach is removed and how with the bougie and the size of bougie we use. Talk to me a bit about the staples, because here's a funny one.
Okay.
Will these things go off in the metal detector when I go home? So I'd love to hear that answer.
Are they there forever?
Are they there forever? And is there long-term effects of having them inside? Let's say 10, 20 years from now.
Sure. It's a great question. So they will not set off a metal detector. So the staples that we use are made of titanium. And they do not actually set off the metal detectors. If you are concerned about it, you're more than welcome, obviously, to ask TSA to screen you on the side, but you can walk through an X-ray machine or a metal detector and you should have no problems whatsoever. They are there for life. The titanium, your body will not dissolve the titanium. It will grow over it, so it kind of hides the staples. They don't seem nearly as fresh as what we look at. If we're looking at something, 10 years down the line, you won't see the staples kind of poking out of your stomach. And they will be there for your whole life, and they hold on really, really well. So the staples are not anything that I've ever seen cause any sort of, concern or sort of
Long-term issues.
They're really, really well designed, in fact. So it's one of the reasons that bariatric surgery, I think, has become much more feasible is, if you look at the early bariatric surgeries that they were doing kind of back in like the 1950s and 60s, one of the reasons that there weren't so many of them is because it was this, sort of incredible undertaking to do it. You had to, like a big incision and do everything with sutures, and the leak rate was so much higher, of people having like holes in their stomach that they didn't realize were there. And when the National Institute of Health first put out their recommendations for who was eligible for bariatric surgery in the early 90s, they were basing this on sort of what the safety profile looked like. So how much benefit versus how much risk do you look at? That was 30 years ago now, and the staples and the platforms and the laparoscopic equipment and everything have gotten so much better to the point where they've actively revised a lot of these things to reflect the fact that everything is so much safer than it used to be. And so it's really fantastic, like how many leaps and bounds the stapling technology and the minimally invasive technology have made to make this so much more beneficial to patients with so much reduced cost. So staples I've never seen cause an issue.
Awesome.
And they're tiny. These are like little teeny tiny. These aren't like a stapler you get from Office Depot. I mean,
yeah, because when you say staples, you're thinking of like a half rectangle.
Right.
Just is that's not what we're looking at, right?
No, it's much smaller than that. We probably, our normal staple load, so what we use to sort of help divide the stomach and staple off the stomach, contains. It must be at least 100 staples in about a 6 centimeter spot. And so it's a very
wow.
tiny. Yeah.
Wow.
Yeah, it's very cool.
Yeah, because when I see it too, it doesn't even look like staples at all. It looks like it is just being like cauterized.
Yeah.
Actually.
And I think it's important too for people to remember, because even people who have had surgery sometimes say, will I get my stitches removed? Do I get the staples out? So when we're saying stapling the stomach, that's not the abdomen. That's not what I see when I'm looking at you. If you were wearing, if you didn't have a shirt on, I'm looking at your abdomen. But from the inside, that's your stomach, and that's what's being stapled.
Absolutely, yeah. And so that's definitely one of those medical distinctions. And I do it in everyday conversation where I'll say like, we'll go through your stomach to do this, that, and the other. Well, what I mean to say is, if I'm talking about the skin I see on the outside, that's technically what we would call your abdominal wall.
Right.
And so when I say, we're stapling the stomach, I should be accurately saying It literally is the organ called your stomach that sits inside your abdominal wall, inside your abdominal cavity, and that's what we actually staple. And so, with regard to what you actually see on the skin, the cuts that you see on your abdomen, that is all closed with dissolving stitches, and everything is good to go when you leave the operating room. You shouldn't have any upkeep for that whatsoever, nor will you ever have upkeep for the staples. So all of it is pretty much sort of set on the path, and you guys, it's sort of set it and forget it for you guys.
So when it comes to now, this leads me to the next question. With the staples, can you have it opened? Can you overdo it with the food and essentially have
and bust that staple line? Basically.
Staple, yeah.
It's not possible.
So the staples are so strong that I will tell you that, we check our staple lines a couple different times before we leave the operating room, because we want to make sure there's no holes in that staple. Obviously, we don't want you leaking out and getting sick and stuff like that. So before we leave the operating room, we feel really confident that the staples are good and solid and have sort of sealed down the way they need to seal, right? They are actually stronger than your stomach tissue. And so if you talk, there's a couple different things that you sort of talk about there. One is the idea of overeating and stretching things out. You can try to stuff a bunch of stuff in there and increase the pressure. You'll feel it. Your body will kind of go, oh man, that really, it's kind of like overeating, eat with or without it. If your stomach is stretched, it'll feel it. But when it stretches, it is not going to stretch where those staples are. It's going to stretch everywhere else in your stomach, because those staples are much stronger than the rest. So if you think about it, it's kind of like trying to find the weak spot to kind of push out a little bit, and those staples are not going to be the weak spot. So
and that is not advised, correct?
No, I would not advise
don't push and see how much you
I'll
get.
tell you, a lot of people do anyway. It's not, they don't do it intentionally, but they'll be sitting there drinking water or lose track of something, or they'll take a bite of something, not realize that it's kind of filling them up. And your body will tell you, you'll kind of go, oh, I can really feel that stretching. And then it's a valuable learning experience, let's put it that way, because a lot of people subsequently say, like, I felt that and I realized, like, right then and there, like, I don't want to stretch that out.
Never want to do it again.
Never want to do it again. So, it does happen. If you stretch it, occasionally, it's not going to all of a sudden give you this permanently stretched stomach. You're not going to undo the hard work that you've already put in, but you will feel it if you do stretch it, and you'll kind of go, huh, okay.
It's just more of like a response, a negative response to tell you to stop.
Yes.
Right?
Yes.
Because I tell people, hey, your body will tell you to stop long before there's real damage. Would you agree to that?
I completely agree. Yep.
Perfect. Yeah, because that's what it is. You're just basically full, right? Yes, you go to an all-you-can-eat buffet, you're going to feel a certain way, but now with this tool, you're going to feel that certain way with just 6 ounces,
exactly.
Right? Or 4 ounces. It will be a little bit less too, because of the healing and the inflammation right off the bat too. We're talking within the first couple weeks, correct?
Agreed. Yeah.
So one of the criteria when we're talking to prospective patients on the phone about coming here, moving forward with the process, one of the questions that we ask them is do you have a primary care doctor? And some people are like, well, I mean, I'm generally healthy. I haven't seen somebody in an X number of years. And we explain to them it's important to establish a relationship for a couple reasons. Because you're having surgery outside of your home state, your home city, we want to make sure when you get back home you have somebody to check in with. Those are for those folks that are really almost in good health, minus the excess weight. And then I think there's a set of patients that they probably got their doctor on speed dial because they're on multiple medications and they've seen them multiple times in a year. Explain to our listeners why it's important to have a primary care doctor going into this procedure.
Yeah, absolutely. I think that if you think about sort of what we mentioned earlier, you want to have a full support team when you're going to do something like this. And that includes somebody who can help you locally, We're always here for you. We will always pick up the phone. But, we live out here in Las Vegas, and let's say you're from North Carolina, there's, we can call, facilities over there, we can do stuff, but, short of having, the ability to kind of say, hey, we can't really practice medicine in the state of North Carolina, having someone there who we can talk to and sort of like convey sort of information to and have a conversation with about how things are going is always a great idea, because then it means you've got an ally right there in your state, right in your city, who can go out and get stuff done for you immediately. And we're still a part of your team. We're still 100% on board. We're still helping, however we can. But it means that you've got a local on the ground right there getting stuff done for you, so that you're not having to say to yourself, oh crud, if I need to get labs, do I have to go all the way back to Nevada to get my labs drawn? That is just, that's not fair to you guys. So having a local doctor for just sort of the routine stuff is a great thing. And like you mentioned, there's also some patients who come out who are on a lot of different medications. Well, this is a very, life-changing operation in terms of, your medical, history heading forward, as it were. Things like hypertension meds, reflux meds, diabetes meds, all sorts of things. And those will probably need to be changed over time. And so keeping a close relationship with a doctor who can help manage those on a month-to-month basis is a lot more beneficial to your overall health, and kind of calling back to us and be like, hey, what do you think about this? Here are my numbers, that sort of thing. We want you to have all the support you need and to make everything as smooth as possible for you. And so having that local support, I think, is almost as critical as just being able to call us whenever you need us.
I'd like to add that a lot of those comorbidities and medications related to them can change very fast.
Yes.
Rapid changes
change very fast. And even if you are, for example, diabetic and you are on medication for diabetes, I advise that you check your blood sugar regularly afterwards, because you may get off of those medications very quickly. So, and if you are taking them without monitoring them or having somebody to call for that, you may be feeling miserable, wondering, oh my gosh, what is going on? It's like, well, because now your body is adapting and adjusting very quickly to
a bunch
in
of
a healthy way, in a very
Absolutely,
healthy way. So
absolutely.
And when I say a very quick amount of time, sometimes it's as soon as
overnight
or even a week.
Yeah.
So definitely.
So your guys' suggestion, if you're one of those that have prescribed medication from your primary care doctor or a specialist for, hypertension, diabetes,
heart disease,
these things, how quickly, so I get home today, when should I see my primary care?
I would ideally like you not to wait more than about 2 weeks at the max.
Yeah. Okay.
I think just getting in there and just sort of just touching base, making sure that everything's going okay. Like you said, it can be any of those medications, and hopefully it's not an emergency sort of thing, but like they'll take your blood pressure, they'll check your blood glucose, they'll, all sorts of things. And you can start even before your weight starts changing. You can see changes in how much insulin you might need, or what dose of a antihypertensive medication you might need, and can happen very quickly. So as quickly as possible, especially if you're feeling symptoms, but definitely within 2 weeks if at all possible.
Good.
If even possible, I would recommend beforehand.
Yeah, beforehand.
Let them know, hey, I'm about to do this. I'm about to get this tool. I'm about to do this procedure.
Yeah, I think a lot of folks do that depending on their relationship with their doctor,
absolutely.
If they're comfortable too. And listen, there are some doctors that say, I don't advise, I don't believe in a surgical intervention, but there's a lot of doctors that we get referrals from across the country that say we've seen incredible success, and they send their patients to us. And so it is important. It is, again, if you have not had surgery and you're considering it, you call our office. That will be a question that we ask you.
Absolutely.
It's definitely important. So another question relative to medications, this one is birth control. And the reason I ask this is we, again, on our support group, Alex, have you seen all these miracle babies? And somebody made a post, and asking about birth control, or asking, how long should I wait to get pregnant? Tell us about pregnancy after weight loss surgery. Is it easier to get pregnant, and why? And if so, is birth control an important thing for women?
Absolutely. So to answer the first question, yes, it is easier to get pregnant after surgical weight loss. And the reasons is it has a lot to do with sort of hormonal balances more than anything else, and has sort of your body's own natural inflammation, stuff like that. One thing people may not realize is that adipose tissue, fat tissue, actually acts as a pro-inflammatory agent. And so having a lot of it sits around kind of gives your body almost like a chronic stress response, right? And you can imagine removing that level of stress, starting to lose that weight, will let your body kind of relax a little bit more, and may help you a little bit more with, like you said, the miracle babies and that sort of stuff. The other thing fat tissue does is it tends to change somebody's hormone balance a little bit, right? And so we see folks all the time who come in and they have something like polycystic ovaries or low testosterone or things like that. And a lot of that can be traced to sort of the estrogen and testosterone levels and the relative ratios in their body. without getting too technical, as that fat comes off, the ratios tend to normalize a little bit more and make things a little bit more sort of biologically feasible for your body to be able to do the things that you're talking about. Now, when should, what do you want to do about birth control? When would you think about getting pregnant from that perspective? With regard to getting pregnant, I would say feel like you've gotten to where you feel successful with your weight loss before you consider any pregnancy. The reason being is that because if you were to get pregnant while you were still losing weight, well, now you're playing sort of two games at the same time, and it's hard to win at both, and it's very challenging. And so, we'd be here to support you for something like that, but we'd want you to make sure that you feel like you can sort of just tackle one thing at a time, as it were. And so what I would say is, let's say that, you lose weight for 9 months and you sort of find your new normal and your happy place, and you're living the life that you want to live, and you've met your goals. Stick with that for a good, 6 months, even 9 months, even. I would say don't try to get pregnant, don't actively try to get pregnant for, I'd say, even 18 months after the surgery. And that just gives you a chance to get used to your new body and kind of reset everything. Now, there's obviously some variation with that, and I think that's totally fine, but pregnancy, breastfeeding, that sort of thing, it all gets a little bit better sort of once you're at your new normal and stably so. So with regard to birth control, obviously, if you want to try to stave it off, and I would absolutely encourage people to use birth control for that time until you feel like you are, ready to, try to get pregnant. And so
how soon can you start using birth control?
I'm okay if you use it, the day after. Taking a pill is totally fine. The one thing I always tell people, and this is not specific to bariatric surgery, but anesthesia has a way of messing with menstrual cycles, and so you've got to be very careful about.
Interesting.
Yes, and so if you're on birth control coming into the operation, continue it on through. That's totally fine. I've had some people ask when they can get back to sort of intimate relationships, as it were, and I'd say you absolutely can whenever you feel comfortable with it, but keep in mind that around the time of an operation, your menstrual cycle may be a bit irregular, and so you may end up in a situation where you want to take additional protection to make sure that you have the outcome that you would like from something like that.
It happens. I mean, even just with the gals in our group, I have seen multiple whoopsie daisy couple months after, wasn't expecting this. And then there's also these beautiful stories. A gal, we had her as our patient 2017, thought she could never get pregnant, was very successful in weight loss, and then she got pregnant with twins naturally, and they're beautiful and healthy, and she's healthy too. So it's really encouraging to see that, but it's also scary, right? Because you don't want to invest a lot of time and money into doing this.
I think people have to remember that they've worked hard to get to the point where they even get to see us, or where
exactly.
They come to see us. And, as much as, your life can change and children may be something that are very important to you, just keep in mind that it can happen in its own time as well, and so hopefully you don't feel like you have to rush into something like that. But if you do, definitely let us know, and we'll talk about sort of the nuances of your specific scenario.
Exactly, and I've had several situations and conversations, and it changes the game. Obviously, now you are not just thinking about yourself; you're thinking about your baby, right? So you were talking about. This conversation has gone into pregnancy, but we didn't touch on the men of this. Yes. And yes, the hormone and all of those change. We've had scenarios where I'd get emails of guys saying, hey man, my testosterone is gone way up. So on that side of things, you can still
absolutely
get somebody pregnant.
Right?
Get someone pregnant.
Keep that in mind for sure. Yes, it is a double-edged sword. It does take two to tango on that side, on that front. So so adipose tissue will take normal levels of testosterone and it actually converts it into estrogen. So men who have suffered with low T, as they start losing some of that fat, you will notice that your energy level not only increases, but your testosterone level, if you were checking it, would also go up as well. So
that's incredible. Wow.
And that will also translate into the energy that you get in the gym and how your body adapts to the lower calories. Just, of course, making sure you're getting the nutrients and the protein, but how you can still be more energized and still push the weight in the gym, and et cetera, et cetera.
Absolutely.
Well, do we have a couple more minutes for a top 5 questions of scientific explanations of certain things? We got the doc here. We might as well.
Yes, let's do it.
Okay, so this is the burning question we all have. Is there a scientific explanation of why we experience stalls? post surgically?
So that's a great question. And Alex, I'm sure you have some good information on this as well. So I'll let you hop in. But, generally speaking, so weight stalls, if you think about what weight is, all it is literally just the mass that you're carrying, right? And so it's a product of things like your metabolic rate and, sort of what different kinds of tissue in your body you're doing. So, when you get into the sort of the post-operative phase, your goal is to burn fat and build muscle, right? Well, obviously fat burning results in mass dropping, but muscle building results in mass lifting, right? And so if you're experiencing a stall, one of the reasons might be as simple as something like, hey, I'm putting on muscle and I'm burning fat and it's going great, but the muscle doesn't, it's a little bit of a misnomer to say muscle weighs more than fat. It's denser than fat, but you could lose 2 pant sizes and not lose a single pound because you're putting on muscle and burning fat and it all stays the same. So if that's a stall, that's one reason. So there's definitely some science behind something like that. Alex, you were saying something.
Yeah, no, this is where it comes down to success isn't always measured on the scale. And this is relative now to when you had your surgery, because your priority is to lose fat, but your body's priority is not. It is to heal. Absolutely. It is to adapt. It is to adjust. And now your resources are limited. You are getting less water. You're getting less nutrients. And now organ function becomes a priority, and healing what is now tissue repair, cellular repair, and that is where the resources are now being used. So you can, of course, lose inches and not pounds when you are healing. And that's where I say you are not necessarily stalling, you are healing. And again, relative to when you had your surgery, and this is typically within the first 6 weeks.
Oh, I get that. You see the posts. I add somebody to their group about 7 days post-op. I'm guaranteed about 7 to 14 days after that to get their very first post about, I haven't lost a single pound this week.
Yes.
And so at that point in time, when you're 2-3 weeks post-op, is it even fair to call it a stall? I guess in these folks' mind it is, but
I think it depends on sort of what you're. I mean, it's a semantic argument, but to me, not having your weight change between like 14 and 21 days, or where it is, to me that is a normal post-operative process. And so I tell people that this isn't. It's not exactly like a plane taxiing down to a runway where you just kind of like slowly drop your altitude. Yeah. It's like a plane that's sort of stuck in a holding pattern, basically, in the sense that, like, if you want to call it a stall, you can, but it's like you'll drop 5,000 feet and then you'll kind of hold there for a little bit and you may drop again, and then eventually you'll start seeing just sort of slowly come down very smoothly. But your body is doing what it's supposed to force the changes that you want it to do. So if the weight doesn't change, don't get too obsessed about it. I don't know how often you ask people to check their weight. I tell them if you go over once in a week, you're just going to drive yourself crazy.
Exactly.
Oh, absolutely.
Agreed. 100%. Yeah. 100%. I do say that it is more of a perspective as well, because what you feel is a long time, 2 weeks, right, is actually very short amount of time for your body to adapt and adjust and get used to some certain changes. And also, don't focus on what you have not accomplished today or yesterday. Look at how far you've come. Okay, because I do see a lot of frustration when it comes to, I haven't lost weight in the last week, I haven't lost weight in the last 2 weeks, but in the last 2 months you're down 30 pounds. Right.
Well, and I guess for those who have been successful on their pre-op diet and say they lost a good amount of weight in that 2 weeks in their pre-op diet, and they're used to seeing that number go down, then they have surgery and they're excited. This is the solution. I'm ready to go. I'm going to lose weight. And then just like Alex said, we have to remember your body, even though the little incisions, you got 5 little tiny incisions, it still is a pretty significant inter-abdominal procedure. So let's remember that your body is, like Alex said, focusing on healing. Stay the course. It's important to continue to push through. Remember, we're your support. And, if you put 20 pounds on and if you put that much weight on in a couple of weeks, that would not be normal. But I think the stalls in those periods of time.
And again, like I said, I think that if you're truly going to say you're stalled, you want to look at it across the board, right? So if you're saying you're stalled, you're saying everything is exactly the same as it was the week before, right? So the weight's the easy thing to pay attention to, but think about things like your energy level, how much you're able to take in, especially in the early post-operative period. In the first couple of days, you may be like, oh man, how am I ever going to drink as much as I need to? It's going to keep getting better. And then you're going to look at things like, okay, my pants feel looser than they did last week. Like that's an important thing to remember as well. So to me, a true stall is everything is exactly the same. Nothing has changed. And if you ever do feel like that's, we definitely don't want to discount that. If you feel like everything is the same, that's what we're here for. That's what your support team is for. So if you feel stalled, you call us and we say, let's see what we can do to make it better for you.
One more quick question.
Do the hottest one. The second hottest question. This is actually for both of you. I'm going to ask both of you guys.
Okay, go for it.
We want the scientific explanation of why do I lose hair post-operatively? And is this inevitable? Is this going to happen to everybody? And tell me why is this my locks, man?
Okay, so I talk about hair loss with, well, number one, long term is you need to get adequate protein intake. I say that the number one factor with hair loss long term is going to be protein intake, but initially it's the shock to the system. Okay, and correct me if I'm wrong, I would say that 50% can lose hair initially, and I like to associate it with like pregnancy or giving birth. Okay, so the shock to the system will have you interpret that shock as a threat to your life, and if that happens, your body will slow nutrients to the areas of the body not essential for life. Unfortunately, hair and nails.
Yeah, the body is stupid. It does things like give energy to the heart as opposed to like growing hair.
What is it doing? Why is it doing that to my hair, man? So I say if you follow the rules, if you relax, if you drink the water, if you get the protein, eventually, and in a very short amount of time, your body will say, hey, we're not dying. Everything is cool, and will restore your hair. Totally. And then long term, it would be the lack of following the protocol when it comes to the food and the protein.
In the grand scheme of things, speaking as somebody who enjoys, having hair, I think that, it would be a little bit distressing if mine were to start falling out. I'd probably wear hats more than I do, which I wear them almost every day anyway. So, but Alex is absolutely right. Your body is sort of saying, okay, I'm working on a severely reduced budget right now. So where am I going to put my money? Right. And so if you're talking about, everybody has probably experienced this with COVID going on, like your salary gets reduced or your hours get reduced, and you all of a sudden, you're like, okay, I got to pay for rent and I got to pay for food, but I can't go out to the game anymore, or I can't do that for now. And so the hair, to a certain extent, is the game. It's the game, right? And so you're like, all right, well, once you kind of get over those meager times where your body is sort of saying like, okay, I understand how to work now, I'm becoming a more efficient machine, then it's going to be like, all right, let's go. I saved up some money. Let's get that game going. You'll get back to that. And then, like Alex said, in the long term, it's about sort of making sure that you stay up on everything that you need, right? So one of the things that we always keep an eye on, one of the reasons we support you long term, is that we want to make sure that vitamins, minerals, things like that stay at the levels they need to. And like the protein is important for hair, but also things like, vitamin A, vitamin E, vitamin D, those sort of things are, important for things throughout your body. And so that's why we follow you long term. And that's why we want to make sure that you're able to get everything done that you need to get done, because ultimately your hair will come back. It may thin out for a little bit, but it can restore. It will restore.
So there is not a way to avoid it, or there's also not a way to know if you'll be one of those that falls into the extreme hair loss category.
Definitely hard to predict, and everybody has a little bit of a different experience. But if you find yourself at the point where you're like, hey, I feel like my hair's going crazy, like I'm going bald, and you're like, but I'm losing 30 pounds a month. This is fantastic. Like, where am I going? It's totally okay to ask yourself, sort of, as you go through this process, like, do I want to think about sort of balancing things a little bit different, right? Like, you can always sort of say, hey, my body is telling me that, yes, I'm losing all this weight, but I'm also losing my hair. Maybe I draw back, or maybe I talk to Alex, and Alex is like, oh, increase your protein or try this vitamin or whatever the case may be. You can make those adjustments. And so if you feel like you're watching it go and you're like, well, crap, now I just got to watch it go. Again, we're here. We're here to support. So call us and let us know what we can do to help.
I do want you to consider one thing is if, let's say you are 6 months out and you are losing, your hair is thinning, it didn't take a week to get you to that point. It would have been probably a couple months, a few months to get there. So for me to tell you to increase your protein, it's going to take a little bit of time to restore as well, because now we have identified that, hey, you're actually not getting enough protein. And now it's not going to take a week or 2 weeks for you to do that and to reverse that. Give it another few months of consistency for those things to change, because we do want instant results, right? We want instant results.
Trust the process, like
Trust
Alex
the
always
process.
says.
That's
It's
right.
true. I see
Compliance
people.
is the science.
That's
Sam
right.
Presti over there.
Yep, I see people echoing that on the support group too. So I know you guys are listening. I love that. Andrew, thank you so much.
Thank you guys. This was
for
a lot
taking
of
the
fun.
time.
Let's do it again sometime.
Yes,
think
this
we
was so much fun.
had a lot of topics.
So much to talk about, and yeah, we'll do a part 3 possibly, and we definitely have to meet the other doctors as well. So you're the first actually of first interview when it comes to this platform, and I feel that the patients will love to meet everybody else too. All right, Doc. So, any last words?
Thank you guys for listening. Look forward to meeting you.
Awesome.
Right on.
All right, guys. Well, thank you for listening, and we will see you in the next. Peace.
This was another episode of the Blossom Podcast. For more motivation and future episodes with Alex, make sure to subscribe so you don't miss out on any life-changing moments.